In this video with the AnKing, I'm going to talk about how to honor your internal medicine rotation, and this includes how to use Anki for the shelf exam, which is very important because this is a very difficult shelf for many people. If you haven't noticed already, I have a playlist on YouTube. I'll link that in the description of this video, but it goes through every rotation I've been on and my recommendations for those rotations, including a separate one here just on how to honor your OSCEs, which I feel like is very helpful, so I'd recommend watching that. I have done every rotation video so far except for neurology. I just finished that rotation yesterday and we'll be working on that video soon. Now, if these videos are not helpful enough, we do have these AnKing memberships for individualized help. What's included with this, basically, we have a bunch of medical students that are very successful and have done well on their board exams and shelf exams. We're also Anki experts, and we would be more than happy to help you with that. This also comes with some other perks like beta add-ons, early release, YouTube videos, things like that. The memberships range from $3 to $20 a month, and you can start and stop whenever you want. It's not intended to be expensive. Our goal here is really just to offer something where we can help you. Outline for this video. This is going to follow similar to my past videos. So first I'll go over week to week what my life was like on the rotation. Next is what things I would have done the same, what things I would have done differently, and then some general rotation tips for internal medicine, and some biohacks, which luckily is not as intense because this is not quite as bad as surgery rotation, for example. So the rotation work hours, my first 2 weeks were on inpatient pulmonology, which I thought was a lot of fun. It was specialty weeks, and I was usually working Monday through Saturday about 7 a.m. until 4 or 5 p.m. Saturday was a half day, and we were done at noon or 1. The next 2 weeks were at the VA. I was on inpatient general medicine. This actually is kind of a lie here. This is about the general hours, but I was working long day, then medium day, then short day, so it's kind of just a different strategy there, but it's also Monday through Saturday inpatient. And then weeks 5 through 6 was outpatient internal medicine. And that was just a standard schedule, Monday through Friday, 8 to 5. And that was about what I was done. So 6 weeks plan. Like, what did I do while I was on internal medicine for studying for the shelf exam? Before the rotation, I did all of the Anki flashcards tagged under the internal medicine tag with no dupes in the AnKing Step 2 deck. And I did about 2,000 of the 3,600 cards total. Some of those I had done already on previous rotations, so I didn't actually have to do about 2,000. But I started doing these about 2-3 weeks in advance, and I was probably adding around 40-50 cards a day. I was going through anywhere from 80 to 100 cards a day, but I was marking a lot of those as things that I didn't necessarily need to do as flashcards because I had a good Step 1 foundation. But yeah, there's a lot of flashcards for this rotation. I did feel like they were pretty helpful. Next thing, week 1, I started just doing AMBOSS questions. I did 20 to 40 questions a day. And then week 2 through 4, same thing, 20 to 40 questions a day. It really just depended. Some days I would do 40 questions and then not the next day, kind of a thing. I put 40 questions here, but it was probably averaging more around 20 to 30 a day. And on those AMBOSS questions, I was only doing the 2 through 4 hammers. I started doing the 1 hammers in there. And then once I noticed that I was getting all of the 1 hammers right, I just adjusted and did the 2 through 4 hammers because there's so many questions. It's just hard to get through, really. And then I did an MBME at the end of week 4 just to kind of see where I was at. Week 5, I did MBMEs, and I split these up. So they're 50 questions each. I just did 25 questions every day, basically. And then week 6, same thing. I did 2 25-question days with the MBME. Then I studied for the OSCE, which was, near the end of my 3rd year, so it was actually pretty easy. Things I would do the same. I would definitely do the MBMEs and the AMBOSS questions. I feel like AMBOSS has been really good for the shelf exams. I have used UWorld on a couple rotations, and I feel like AMBOSS has been superior. The next thing is MD Calc. There are so many calculators on this thing and different algorithms and scores, like a Wells score for pulmonary embolism thing, but there are so many, and they're all internal medicine related, and the attendings really like them on this rotation. So go to MD Calc on basically every patient and see if there's some calculator you can do on the patient that you're following. That was really helpful. Attendings seem to like that. Doing a full exam. And the reason I say this is because, one, you're on a rotation where your job is really not just a specialty, but you're taking care of the whole patient. And this is a great time to practice your skills in doing a full exam, but also because a lot of these things are so interrelated, you'll notice and you'll find things that are helpful. I actually had an instance on this rotation with someone who was there for COPD exacerbation, and I noticed he was having some ankle pain when I was doing that exam, and we ended up doing a CTPA and finding out that he had a pulmonary embolism. So things like that can be very helpful, and I would definitely recommend it. That will make you look better on your rotation, obviously, if you find things that are pertinent. The next thing, ask your attending, what do you expect of me to honor this rotation? I have found that this is super helpful throughout all of my rotations. The attendings, I kind of had this feeling at first. I was a little worried that they would think I was kind of a gunner sort of an attitude, but I have found that attendings actually really appreciate you coming forward to this, and they kind of have expectations that they want you to do, and they'll tell you, and they're different for every attending. And so doing this helped me cater what I was doing to that specific attending. I felt like that helped me get better evaluations. Also along the lines of things I would do the same, but this time for Anki, that's going to be, I actually recommend doing the questions first and cards later. This is opposite of what I recommended in your first couple years of medical school. I just feel like you're so tired at the end of the day. You get home at 5, 6 p.m. Doing practice questions is the last thing you want to do. And usually I was able to do my flashcards, while I was on the bus on the way to school or during lunch or something like that. Next thing is interval modifier. I set this to 140% near the beginning of my third year, which makes it so your retention rate goes down a tiny bit. I felt like this actually was reasonable, though, because you're seeing a lot of these things in the clinics, and so you remember them better. But also, this is my second to last rotation. I had kept all of my flashcards going, which was a lot of work. But I was only doing like 20 to 40 cards of past material, and I think part of that is because I had the interval modifier set to 140%, and that's a lot more manageable than trying to do over 100 flashcards a day on top of practice questions and keeping a really busy schedule. The last thing is custom filtered decks. So these are super important. The reason I recommend them is because you can make a custom filtered deck for a missed questions tag. And when you do that, then you can pull all of your missed question cards into that deck and pay extra attention to them. Along the lines with this, I made a goal a couple rotations ago, and I feel like this has improved my shelf scores significantly because of this. I decided I was going to make one flashcard for every missed question. I didn't pull flashcards or restart flashcards. I made a flashcard to help myself synthesize the information. I tagged it with missed questions so it would go into that custom filtered deck, and I tried to do one for every missed question, unless it was like I really missed it for a dumb reason. Okay, so things I would do differently. One thing is share research every day. And the reason I mention this is because this is a very academic rotation. And a lot of the attendings, I found out later, wanted me to kind of at the end of a presentation, if a patient had something going on like a pulmonary embolism or heart failure, then you share some research on that topic after your presentation. And it's just very simple, like, there was 200 patients studied in this study. This is what they did. This is what they found. Somewhat related to your patient, but doesn't necessarily need to change the guidance of your patient, which previously I would only share research if I was going to make a decision off of it. This is just a very academic rotation. They want to teach and learn on every patient presentation, basically. Documentation. I am the type that I like the surgery documentation style a little better, where it's very quick, concise. This is a rotation not to do that. They wanted everything very particular. They look through a lot of things. They want good tracking of what's been done over time and keeping track of everything, and rightfully so, honestly. But your documentation is going to be very important on this rotation. The next thing, don't fixate on diagnoses. The reason I say this is because there was patients where things were very obvious, or I felt 90% certain that I knew what was going on, and that may be true, but this is the rotation where they really want to teach, like I said, and so they want to work on your differential. So for whatever it is you have, you should be arguing a differential, even if it's significantly less likely things. You should explain why you think it's less likely, but the fact that you were considering it, and that's going to be very important on this rotation. This actually kind of goes along with the first bullet point, but Wiki Journal Club, I found out about this way too late. It is a really cool website. It's also an app, apparently. I haven't used it, but it just synthesizes really big studies down and just says, like, here's what was studied, here's what we did, here's a quick summary of the results. It's a great resource. I wish I'd known about it earlier, so I would recommend checking that out. General rotation tips. Like I mentioned, everything is academic. This rotation, even if you don't love internal medicine, which this is something where I knew I wasn't necessarily going to go into this from the beginning, but they will teach you, and they will teach you a lot. You'll learn a lot if you're open to that, and they want to teach you. So if you have this attitude of learning and teaching, and that, you're going to be looked upon better. You're also going to have a better experience. So just kind of keep that in mind as you're going through this rotation. The next thing is care for the patient as a whole. And the reason I bring this up is because, when you're on your neurology rotation and somebody has high blood pressure, you may say, oh, we'll just defer to the primary care providers to manage that. But internal medicine, you really are caring for the whole patient, even if you aren't the primary provider. You're caring for the whole patient. And there were a lot of times where just noticing little things like, hey, this patient has GERD, why don't we just make it so that Tums are available to them, or maybe start an omeprazole or something like that. Can really win you some brownie points, but also, truthfully, care for your patients. I mean, you can make them feel comfortable, and also just kind of keep in mind that what are the patient's goals? What do they want to get out of this rotation? I did have a few patients pass away on this rotation, and really understanding what their goals of care is an important part of this process, especially on internal medicine. Okay, I kind of put this in here as a joke, but it's kind of real too. If you're having a problem and you can't figure out what it is, look at the medication list, because it probably is where your problem is. And getting a really good history of when they started medications, when they stopped, all of that is going to be very helpful, because many of these patients are on 20 or 30 medications, and no, that is not an exaggeration. But seriously, if you can't figure things out, kind of start with the medications. That's probably a good place to start. Biohacks, luckily, like I said, this is not surgery rotation. It is really nice to have a clipboard like this. I have had this my whole third year, and I've loved it. I'll put a link in the description of this video for the Amazon link for this particular clipboard. It's really handy. It fits in your white coat very nicely. The other thing I would recommend for internal medicine is just some good compression socks. And along with that, some good shoes. You are standing for quite a bit during rounds, but not as bad as surgery rotation, and otherwise really not that bad. So good luck on your internal medicine rotation. This is a great rotation. And like I said, if you want some individualized help, sign up for our memberships. We are more than happy to help you. We want to give you some advice and all of that. There will be more videos to come. I'm planning on making a video on how I used Anki for all of third year for clinical rotations, as well as a video on step 2, what I did to study for that, and all of that jazz. So look forward to that. Thanks for learning with the AnKing. Be sure to subscribe to our YouTube channel here, as well as follow us on Facebook, Instagram, or Patreon. That is at AnKingMed. Also, feel free to reach out via email or check out our website, ankingmed.com, for more tips and tricks.